Go on, sorry.
My mum has a severe mental illness and had to wait 4 days to be seen when experiencing a crisis. So how will you improve emergency services for those experiencing a mental health crisis?
So Amelia, just tell me a little bit, if you don't mind, about, and thank you for sharing. Thank you for sharing the story with me. You tried to get services and they just weren't available. Is that the problem?
Yeah, crisis team are meant to come within, well, I think within an hour, especially if you're experiencing psychosis. But it took 4 days for them to come, which is scary, obviously.
And that's from the local NHS trust, is it?
Yeah.
Right. Well, thank you for sharing the story with us. Let me just say something about each of those questions, and I'll come around for another round in a second. Look, first of all, on Amelia's question, I think it's fair to say that mental health is the Cinderella service of the NHS, and that is a massive problem because, look, it's a problem for someone in the position that your mum is in, but it's a problem more generally because if you don't deal with mental health problems, then they actually store up massive costs for later. So it's wrong, and it doesn't even make financial sense either. The best answer I can give you is the answer of integration. We've got to move to more integrated services. And that means physical health and mental health joining together and improving mental health services. And there's no real answer other than raising the proportion of the NHS budget spent on mental health. We're going to put, for the first time, rights to mental health services in the NHS constitution, partly to actually make sure that money is properly diverted towards mental health. Because actually the mental health budget has been falling as a proportion of the health service budget, and that's why your mum is experiencing the kind of delays that she's experiencing. So first thing we've got to do is actually raise the proportion of spending spent on mental health, give people proper rights in our constitution. I don't have an easy answer, but that is, I think, the best thing that we can do as a start. Gabs, on your question about GPs, I mean, you'd have to say to me what you think the reasons are for this. I mean, it seems to me, or your housemate, one of the reasons is the, frankly, lack of capacity in terms of GPs. I mean, having 8,000 more GPs, which is part of our plan, is an incredibly important way of relieving some of the burden on GPs. Because if there aren't enough GPs, it just massively loads pressures onto existing GPs. And also, the other thing is improving care for the elderly. If services join up better, if there's less pressure on social services, it is definitely the way to take some of the pressure off GPs. So I think extra capacity seems to me to be the best answer. Anne-Marie, on your question, which is a similar question about nurses leaving the profession, look, you would have to tell me that some of the reasons. My sense is it's a morale issue. If people feel the NHS doesn't have a plan and doesn't have a future, then they think, well, why am I going to stay here? I might go to Australia or somewhere else where it's just going to be easier and less pressured. And so capacity seems to me to be the biggest answer. 20,000 more nurses, a significant number of more nurses, takes some of the pressure off. I don't say it resolves every pressure, but I think it starts to resolve some of the pressure that people face on the system. Matt, who asked the question about your experience with the birth of Toby, so 3,000 more midwives, part of the answer, I think, to you, Matt, because, and one of the things about the extra midwives is that we want every mother to have one-to-one midwife care. So you have one midwife who's with you throughout the stages of your baby being born. And it's that kind of assigned care that I think will make the difference. But there's clearly capacity issues also that we need to look at around capital equipment and indeed, frankly, space in hospitals, which was obviously your experience. And then, Michael, your question, I think this is an important task. And part of repealing the Health and Social Care Act is to stop the tide towards privatisation and make it possible for services to be brought back in-house. And that, I'm not saying it's going to be instant or easy, but if it's better in-house, it should be in-house. And look, my basic view is the NHS should be the preferred provider, that actually the NHS is best. Now, when we were in government, we introduced private sector capacity, but that was when the NHS couldn't provide that capacity to get waiting lists down. So my view is the NHS is best, and that's what we should follow in government, and that's what we will follow in government. Let's take another round. There's a lady over here.
My name is Hilda. I'm a final year student nurse. From my own observations, many nurses are leaving NHS to join nursing agencies, which are paying a higher rates from the same NHS hospitals. For example, you can have, let's say, healthcare assistant, a permanent, earning £8 an hour. Someone coming from a nursing agency is being paid £23.50 an hour. How are you going to address this, and how are you going to stop the nurses from leaving the NHS to join these nursing agencies which are charging the NHS these higher rates?
Okay, thank you. And there's a lady two along from you.
Hello, my name's Alison.
Hi, Alison.
Hi, I'm a community staff nurse in Salford, and I've actually come back to university to do some specialised training within community. The problem we're seeing out in community is that the crisis that's in hospital stems from not having enough community nurses, you know, to avoid this admission to A&E. So my question is, how do we, you know, encourage more nurses into community, and also as well, you know, avoid the privatisation. We're seeing a lot of our services decommissioned to private companies, and therefore a lot of our nurses going over to the private sector, you know, and I think the problems we face in the hospital stem from not having enough community nurses out there, you know, to avoid this.
Alison, I think it'll be interesting for the audience as well. Just tell us about the impact of this privatisation and fragmentation on your work, because I think that's quite an important part of it. I mean, there's a capacity issue about community nurses, which I'll come to, but how does that affect your work, these services being privatised and parcelled out?
Well, I think that
I'm a community staff nurse from Tameside and Glossop. Part of our district nursing services have been decommissioned by GP surgeries and given over to other trusts as well. Fortunately, there wasn't a job loss at that time. There's a group of us here that are studying to do the district nurse course at the moment, and we're finding ourselves in a position where we've given years of NHS service to community services. We've been funded to come and do our specialist practitioner degree, and we haven't got job vacancies as Band 6 team managers at the end of this.
Because there aren't the jobs for community nurses, basically.
Because a lot of the services have been decommissioned.
Okay, it's a good and important question. I'm going to come to the lady here, with the iPad.
Hello, my name's Sam and I'm Head of Social Work at MMU.
Excellent.
So I want to ask the question.
I was about to say you needed to be applauded.
Yeah, it's...
Yeah, I didn't even need to say it, did I?
I'd like to ask the question what plans the Labour Party have for social work as a profession, and also what plans the Labour Party have for social work as part of the integration agenda with the NHS.
Okay, I'm going to come to a question down here, and then I'm going to come to the lady in the orange and the two people next. Oh, just the lady in the orange. And maybe the lady next to you as well.
My name is Janet Rooney. I'm the undergraduate programme leader for the BSc Honours Physiotherapy programme here at MMU. And have been a loyal servant of the NHS since 1981. I have lived through the internal market, then the third way, which I quite liked. And now we have equality and equity. And one of the questions that concerns me is how we are going to reorganise it yet again, because reorganisation costs an enormous amount of money without bleeding those funds from direct patient care. It alarms me that so money is spent on the organisation and that denies that money to the individuals who most need it.
Okay, great. That's a really good question. I'm going to take the lady over here, and I'm going to take the lady in the pink also on the balcony here. Yeah, hi.
Hi Ed, I'm Lauren, I'm a first year social work student.
Excellent.
I was just... The NHS is being run by private companies like Virgin, and I was wondering what Labour was going to do about this trend.
Okay, great. And the lady in the pink, yeah.
Hello.
Hi, Charlotte.
Hi, I'm Charlotte. I'm a student nurse here at MMU. I'm speaking on behalf of all the student nurses. About the bursary. Obviously, the bursary seems to be going down and down and down, but living costs are going up and up and up. So when we go onto placement for 10 weeks, 40 hours a week, 2 days off, on our days off we're doing university work. How are we supposed to work? But how are we supposed to live? How am I supposed to pay my mortgage? I live on £320 a month. It's impossible. I know this is a career I've chosen to do and I want to do this, but the bursary, it's hard, it's really hard.
Just tell me about what's happened to the bursary. So the bursary's been, forgive my ignorance on this, the bursary's been reduced, has it?
Speaking to other nurses when I go into practice, it used to be a set amount for everyone. I spoke to a few nurses, it was 550, 600, and it seems to be going down and down. I think over the age of 25, obviously it goes on what your parents earn. I am over the age of 25, but still £320 a month over the age of 25. I have a mortgage. It's impossible, but also you have to make it possible because this is the career that I've chosen to do, but it's very hard, the bursary.
What year are you in, Charlotte?
Second year.
And it just feels like an incredible struggle.
It is a struggle, but people do it because this is what they want to do. But people do drop out because of the situation with money. You can't work, when you're on placement, you can't work. It's really hard to work and do placement as well.
And what other access to funds do you have? Do you have access to, I'm not saying loans are a great thing either, but...
You get a maintenance loan, but I think it's equivalent of about £100 a month, so it's £420 a month. It's easier when you're in university because you can work shifts. I think you can do that, but when you're on placement for 10 weeks, it's really hard. Yeah, your parking, you have to pay for your parking. That all comes out your bursary. You don't really get any help, and I was just wondering what...
Okay, that's a good question. Let me deal with those questions, and I'll take another round. So, look, I don't have an easy answer, and in a way, look, my view as a politician is sometimes there are questions you don't have good answers to, but the point of events like this is to hear about these things and to take that away and think about what can be done on this. In relation to maintenance grants, I'm not sure exactly how this applies. We're proposing to raise the maintenance grant. I'm not exactly sure how that applies to student nurses. So, because that may be about universities, university degree courses. But I mean, I hope it would at least have some effect on student nurses. But I can check on that. But I take the point you're making very much, Lauren. On your point, look, we're going to stop this tide of privatisation for exactly the reasons that I've set out. Because it's this fragmentation issue that Alison was talking about, that if you fragment the services, it doesn't simply mean the services go out to the private sector. It's much harder to have the integrated care that you need. And look, that takes me to Janet's question. Look, I really have a lot of sympathy with what Janet says, because reorganisations look good in Whitehall and tend to be a disaster when they actually happen. And that's been certainly true of this reorganisation under this government. And so I think we've got to be incredibly careful about engaging in big reorganisations. That's why we've said we're not going to have a top-down reorganisation. And we need to have better integration of services, but it's got to be done in an evolutionary way, not a revolutionary way that just throws everything up in the air. Because the costs and dangers of that for morale, for the waste of resources, for sort of frankly wasting money on bureaucracy are too big. So look, I know David Cameron made this promise and broke the promise, but I'm very, very serious about this